This is Auden. I'm filling Mark for the assessment. Okay, perfect.
And hygiene. Hi, my name is Mark. I'm a student nurse at Moraine. I'm here to do a 5-minute assessment on you today. Is that okay with you? Perfect. Could you please state for me your full name and date of birth, compared to his wristband? Can you tell me what month it is? Could you tell me where we're at today? And can you tell me why you're in the hospital today? All right, perfect, thank you. 8 times 4. I'm going to check the patient next for Perla. I want to make sure those pupils are equal rounds and that they're reactive to light. All right, perfect. Now, they are all of those things. Next, I'm going to check for the mouth to make sure that there's no cyanosis, the teeth are good, the uvula is good, the mucous membranes look proper for his skin tone. In his throat, there's no issues with his throat. Next, I'm going to check both ears bilaterally. I'm making sure that there's no drainage in these ears, but the skin around the ears looks good, and that all looks good. Next, I'm going to check and make sure I forgot to check with the Perla that his vision is accommodating. So could you follow my pen light to your nose? Perfect. His eyes are accommodating. So check his ears, nose, and mouth. Have you had any issues with your vision, with your hearing? Have you had any headaches? Have you had any difficulty swallowing or any pain in your mouth? No, that's good. All right, that concludes my assessment for the neuro. And then normally during patient care, I keep the patient covered, but for the purpose of this video, I'm going to take the blanket off all the way. All right. Next, I'm going to check the patient for heart and lung sounds. So, got my stethoscope here. I'm going to auscultate for heart sounds, starting off the right-hand side here, in the second intercostal space, just to the side of the sternum. I'm listening for his aortic pulse, for his pulmonic pulse, the Erb's point. This is the second space. The third space is the Erb's point. The fourth space, I'm listening for the tricuspid valve, and then I'm moving over midclavicular in the fifth intercostal space to listen for his mitral valve and for the point of maximum impulse at the apex of the heart. And this is where I listen to his heart rate too. All that seems normal. Next thing, I'm going to listen for lung sounds. I'm going to use the ladder pattern. I'm checking bilaterally on the lungs to make sure that everything's equal and that there's no wheezing, pops, crackling, anything that's abnormal like that. So 1, 1, 2, 2, 3, 3, 4, 4, 5, 5, 6, 6. All his lung sounds are normal. So I'm done listening to heart and lung sounds. Have you been having issues with coughing, with shortness of breath, or with chest pain? No? Very good. Next, I'm going to check his abdomen. I'm going to first auscultate for his abdominal sounds. I'm going to start here in the right lower quadrant, making sure that there's nothing abnormal. With the sounds, there's a rate of 5 to 30 per minute for his bowel sounds. Next, I'm going to move to the upper right quadrant, over to the left upper quadrant, and then down to the right, to the left lower quadrant. All the sounds are normal and within range. Next, I'm going to palpate the abdomen in the same order, in that same clockwise fashion. Do you feel any pain or discomfort? No? Perfect. Next thing, I'm going to check the genitalia, make sure there's no discharge, there's no skin breakdown, and that there's discharge, skin breakdown. Just one more thing. Discharge or lesions. Perfect. That includes the checking of the abdomen. I would also ask him if he has any stomach pain, pain in the abdomen at all, any nausea, any vomiting, diarrhea, constipation, urinary issues, or any history of issues in that manner. And that concludes my abdominal assessment. Next, I'm going to go to the upper body again. I'm going to pinch below the clavicle, check for turgor on the skin. There's no tenting present, so that's good. Next, I'm going just to do a visual inspection of the body entirely. I would check, also with those lung sounds, I will listen on the back in the 12 spots as well. Sorry. Now I'm going to check the skin in the front, make sure it's warm, even, there's no lesions, bruising, or anything else that is an abnormal finding. That looks good. I would also check that on the back. The warmth is the same throughout the body. Next, I'm going to check his radial pulses for rate, rhythm, and force on a 3-point scale. He's at a +2 for both sides and the same bilaterally, so that's good. Next, I'm going to check for capillary refill in the fingers. I'm checking, pushing down for 5 seconds, releasing and making sure that capillary refill happens within 2 seconds. And I would do this on each of the 10 digits of the top part of the body. Perfect. That all looks good. Next, I'm going to go to the lower extremities. And again, checking like just visual inspection. There's no lesions, bruising, redness, anything that's odd. Checking for warmth. Of course, I do this on the back of the legs as well. Next, I'm going to check for edema. I'm pushing on the bony prominence on both sides in 3 spots, working distally to proximally. There's no pitting edema present. Next, I'm going to check for pedal pulses. I'm checking to make sure that they're bilateral, that they're equal for the rate, rhythm, and force. They're +2 for both on the 3-point scale. Next, I'm going to check here for the posterior tibial pulses for rate, rhythm, and force again a 2. So that looks good. Now, everything on that looks good. Ask him about his ability to walk, his mobility, things like that. If he has any issues. He doesn't. Next, I'm going to ask him to go through range of motion, strength exercises with me. I just ask him to copy me. Can you supinate? Can you pronate? Can you flex? Can you extend? Can you circumduct? I have him do this on both sides. Can you adduct? Can you adduct? So you do it on both sides. And then I also have him do these same range of motion exercises with his lower body. And then that concludes the lower extremities. I got a full set of vitals and the patient, and everything was with the normal range. I'm gonna put him back down to lowest position. That completes my physical assessment on you today. Is there anything else that I can get for you before I go? No? Well, here's your call light. Again, I'm Mark. I'll be your student nurse today. I'll be here to check on you within the next hour. Thank you for your time. Wash your hands and walk out.